name is Lindsey Lassiter. I'm one of the physician assistants who works here at the Vein Company, where we manage venous insufficiency and lymphedema. Phlebolymphodema is what you get when you combine the conditions. That's going to be venous disease that causes damage to your tissue, making you swell and developing into that secondary condition. At the beginning of phlebolymphodema, you may notice it as just a little bit of swelling around your feet and ankles at the end of the day. You may consider it normal and think, I've been on my feet all day, or I didn't just drink enough water. This is untrue, and it's actually a sign that tissue damage is being done as a result of your venous disease. And this is when it's most important that we intervene, because at this stage, your condition is completely reversible. It's not just an excess of fluid that is going to drive phlebolymphodema. There's actually leaking of protein into that tissue, and it's actually doing damage at the cellular level. So much so that researchers are actually starting to liken phlebolymphodema to congestive heart failure. A lot of them are starting to refer to it as congestive lower extremity failure, and they're finding that this tissue damage is similar to tissue damage done in the lungs done by congestive heart failure. So when we do start to see that swelling present, we do need to go ahead and take action. In stage 1 of phlebolymphodema, when you do have reversible swelling, meaning when you first wake in the morning, your ankles may look normal and they may get puffy through the day, this is completely reversible by managing your venous disease and compression. Stage 2 is when the condition begins to advance. That's when you're going to notice swelling present when you first wake in the morning. It typically worsens throughout the day. Again, at this phase, if we intervene with venous treatment and with compression, this is still completely reversible. Stage 3 is when we start to see actual skin effects from phlebolymphodema. You may notice that your skin starts to get thick and leathery, sores may take longer to heal, or sores may develop as a result of your condition. At this point, we can only manage it. It's not going to be reversible, but there are things we can do if you have already progressed to this point. Compression is the mainstay of treatment for phlebolymphodema, in addition to managing the venous disease that is actually causing your condition. Compression is going to help provide good support to your vessels and your lymphatic system to ensure that that fluid is not piling down in your ankles and feet and causing the damage that we just spoke about. Compression is the mainstay of management in phlebolymphodema, in addition to managing the venous disease that's actually driving the condition. In the majority of patients, they will find that their disease can be managed with standard compression socks. These are something that you'll wear during your waking hours to ensure you're providing adequate support to your venous system and helping that excess lymphatic fluid return back into the circulatory system. Compression stockings can be a little uncomfortable to get used to, but typically patients will notice that their swelling becomes less and less, and the achiness and heaviness they have in their legs also is going to decrease with use of these, making it very easy to start to combine in their everyday activities. There's also some tips and tricks we can find online that are very helpful in teaching us on how to get these compression stockings on. It can be a bit of a struggle, but with a little work, it's not something that it should be too difficult for you to maintain. In more advanced conditions of phlebolymphodema, you may start to notice that the natural taper of your ankle starts to inflate a bit, meaning that wearing typical compression stockings can be a big burden or even impossible for you to get on. That's when Velcro compression garments come in. These are designed for patients that do have larger limbs and don't have that distribution between their calf and their ankle as far as size go. Velcro compression wraps will come with a liner. These help to prevent swelling in the foot and the ankle. The liner is also going to help keep your compression garment clean. They'll also come with a Velcro wrap. These can be applied and straps can be adjusted throughout the day as your swelling may increase or decrease depending on your activity level. They're made of antimicrobial fabric, meaning that if you were to have any weeping associated with your condition, these are easily cleaned and will prevent any kind of bacterial growth. These compression garments are inelastic, meaning they're created out of a short stretch material. What that's going to mean is, as your swelling does progress through the day, these will not lose their elasticity. These will provide you with adequate support, meaning that they will maintain your swelling throughout the day. Another essential component of maintaining your phlebolymphodema are pneumatic compression pumps. These are chambered pumps that you utilize twice a day for 60 minutes. As they inflate, they help to manually decompress your legs and help to manually move this fluid back into the circulatory system so that it doesn't sit stagnant in your tissue. It's very important to understand that if you do advance to a compression pump, they don't take the place of compression garments. I like to think of a compression pump like wringing out a sponge in the sink. When the sponge is completely saturated and I make a fist, all of the water is going to wring out of the sponge. This is the use of your pump. However, if I'm to let go of that sponge while it's still under running water, you'll find that it's going to become saturated again. Wearing your compression garments after you utilize that pump is going to ensure that your sponge stays dry and your legs stay nice and light and not swollen.
I'm Tim Lutz, lymphedema coordinator here at the Vein Company. Recent research has shown that the lymphatics play a lot bigger role in maintaining our fluid level in our body. In fact, both the venous and lymphatic system have to work together for the fluid levels to be maintained properly. Sometimes the venous disease is the bigger component, sometimes it's the lymphatic component. When patients come to the Vein Company with those debilitating symptoms, we're going to treat and address both the venous component and the lymphatic component of the condition. And when you're here at the Vein Company, your provider may diagnose you with lymphedema. So let's look at what is lymphedema. Lymphedema is actually, there is both a primary lymphedema, which is something that someone is born with, and that can manifest itself very early in infancy or adolescence. But honestly, lymphedema also occurs later in life, after the age of 30. So it's primary lymphedema. It's a genetic or hereditary disposition, but it occurs after the age of 30. Secondary lymphedema is statistically what more people have. Secondary lymphedema means they weren't born with it, but they have it now. And that can be for various reasons. It can be a previous surgery, lymph node removal, radiation treatment, maybe even a medicine that now causes the secondary lymphedema. Often a knee surgery, ankle surgery, any abdominal surgery introduces secondary lymphedema. But statistically, the biggest reason for secondary lymphedema is venous disease itself. The two just go hand in hand. They both play an important role, and they both have to work and function together to accurately maintain our body's fluid levels and keep those the progressive symptoms away. Patients that come to the Vein Company are coming for help with their aggravating symptoms of their swelling. And sometimes they're asking themselves, do I have venous disease or do I have lymphedema? And the reality is they both systems play an important role in maintaining our body's proper fluid level. If the venous system isn't working correctly, we lead to excess fluid. If the lymphatic system isn't working correctly, we have too much fluid. So it's very important that we look at and address both systems. We do ultrasounds and diagnostic procedures to find out if the problem is the venous element or the veins are the problem. Some patients come to us and the veins are not necessarily a problem, so then we know by default the problem is the lymphatic system. And we can address that with a pneumatic compression pump. Most patients that come to the Vein Company have what's called phlebolymphedema, which means it's a combination of their venous system and their lymphatic system that are both at play, giving them their aggravating symptoms. Typical symptoms of phlebolymphedema would be visible swelling in the legs, heaviness feeling, swelling and tightness in the ankles or knees. It can express itself in the form of what we call weeping. The definition of that is lymphorrhea. It can express itself in the form of a blister that then pops and runs. Other ways that this expresses itself may be cellulitis infections or the risk of getting cellulitis infections and or what we call venous stasis ulcers. The tiredness, the heaviness really affects your ability to go out and enjoy life the way that you used to. And at the Vein Company, we treat both of those conditions. We treat both the venous component and the lymphatics component. And when we address both the venous and the lymphatic conditions, we get fantastic results, life-changing results that can make a very big difference in the lives of patients. So when a patient is diagnosed with lymphedema, in their mind, they automatically think of this classic textbook image of lymphedema that some of us may know or seen, and they think that that's the way life's going to be for them. The reality is it's not the case. With lymphedema, it is a for-life condition, but it's very manageable. We can definitely make major improvements to the extent that many patients get to live life as though they no longer have the disease. When we have buildup of lymphedema, we have a buildup of this lymphatic waste. And when this fluid is in abundance, it begins to cause very aggravating changes to our skin. The oxygen that's available really doesn't make its way to the skin, and we begin to see structural skin changes. Discoloration, it can be either blanched and no pigment, or it can be red and inflamed looking and change the coloration of it well. It can either thicken the skin, which we call fibrosis, or it can thin the skin, which becomes very friable and very thin and easily torn and repair and cuts and things like that. Well, when we address that with treating the lymphedema and the use of compression and pneumatic compression pumps, we keep that fluid moving. We keep the oxygen that's available to get to the skin. So we keep the skin structurally much more healthy and intact, a lot better coloration. We really lower the chances of getting recurrent cellulitis infections. We drastically, significantly affect our ability to lower the chance of either wounds, venous stasis wounds, or keep from getting them anymore. So this fluid is also very inflammatory. And what can happen is a buildup of that fluid leads to a higher level of inflammation in our body. And what we know is that inflammation affects our body's ability to metabolize the fats that we eat. So when we have high inflammation, our body doesn't break that fat down. Instead, it deposits that fat into the tissues. And as we gain weight and we put more fat into that interstitial space, that further affects our lymphatic system's ability to function correctly, which leads to even more higher inflammation, which leads to more fat deposition and not fat metabolism. When we put patients in pumps, we have actually seen that many of them begin to lose weight because we're moving the fluid, we're lowering the inflammation, which allows our body to begin to metabolize that fat and break it down. Your provider may diagnose you with lymphedema and recommend a lymphedema pump. A lymphedema compression pump is a great way to help manage these debilitating symptoms that most people come to the vein company for. When we begin to use a compression pump, we really see major changes in reduction to the size and swelling, or eliminate the size and swelling of our feet, ankles, and calves. Many times, getting a lymphedema pump, wearing compression, dramatically affects a patient's ability to wear their shoes again, to feel like going out and living life again, to have the energy to do stuff that they would like to be able to do. It eases the fatigue, gives them more energy, stamina, as well as reduces the likelihood of recurrent cellulitis infections, the likelihood of not getting venous stasis ulcers, eliminates weeping or blisters if those are an inconvenience of a patient's condition at the reason they come here. So a lymphedema pump is a small pump. It's smaller than a little larger than a toaster. It's not a very big machine. Usually consists of leg sleeves that plug into the pump. There are multiple chambers inside the leg sleeves. Each one squeezes in a sequence, starting with the foot up to the thigh. It delivers pressures in a gradient. And it works two ways. One will move the fluid up out of the legs, right? But it also stimulates the function of your body's lymphatic system to work more efficiently. And so patients find if they'll use a pump once or twice a day, somewhere between 30 to 60 minutes, once or twice a day, they dramatically improve their symptoms or eliminate their symptoms entirely. At the Vein Company, once you have a pump, patients are brought back every 3 to 6 months to reevaluate, fit them with new compression, take a look at their pump use, and if necessary, modify how they use their pump so that we can address any changes in their health that they may see occurring, so that we stay ahead of the disease and keeping it well under control. In 8.5 years, I've had the privilege of taking care of a lot of lymphedema patients. And I can say that a lymphedema pump can make a very big difference. I've seen it absolutely change lives. It can take patients who essentially have no hope, or those that would consider themselves hopeless, those that have gone to doctors, they've seen a lot of different doctors, they've tried a lot of different things that have not worked. But when they come to the Vein Company, we absolutely can turn their life around and give them a lot of hope. There's also a condition called lipedema. Lipedema and lymphedema often go hand in hand. Lipedema is a connective tissue disorder whereas our bodies make an abnormal kind of body fat. Lipedema body fat doesn't diet away, you can't exercise it away, and it's a very debilitating condition, or can be. Many patients that have lipedema have secondary lymphedema. And for those patients, a compression pump can help extremely well, help manage the pain and connective tissue sensitivity of lipedema, as well as help them lose weight and get their life back as well.